Thank you so much, Tamil, for the warm introduction and the invitation to present today. This is a special opportunity for me because I'm joined by Maddie, and really it's her voice who you will hear today. She demonstrates the resilience, strength in doing the work and advancing Indigenous midwifery in Alberta. And then we'll highlight a community-led innovation in Wood Buffalo, Alberta, that is addressing gaps in reproductive healthcare access. And this is a program that I'm very privileged to support and walk alongside my community partners with the Aunties Within Reach program and Ika Pasqua Collective. Tamo, I just wanted to do a quick check and confirm my slides are showing okay.
They look fantastic, Stephanie.
Wonderful, thank you. Okay. So we wanted to begin with acknowledging the land and our caretakers, and I'm going to hand it over to Maddie, who is going to open up our conversation today in a good way.
Thanks, Stephanie. Tanse Kikiaoyak. Before we begin, I wanted to ground us in the spirit of what we're speaking about today: birth as ceremony, birth as sovereignty, and birth as relationship. I wanted to invite everybody to take a breath together and to honor the nations whose lands we gather on today, to honor all of the aunties and grandmothers and birth workers and helpers who have helped to carry the knowledge through the generations, often quietly, sometimes in resistance, but always with love. As an Indigenous midwife, my work is rooted in the belief that every birth carries a teaching, that every family deserves care that reflects their culture, their community, and their sovereignty. And today, Stephanie and I are here to speak about the resurgence of Indigenous midwifery here in Alberta and what's possible when Indigenous women lead and what is needed for that resurgence to thrive.
Thank you, Maddie, and Tanse, everyone. So as Tamil introduced us, I'm Stephanie Montesanti. I'm situated here on Treaty 6 territory and home of Métis Region 4. So this is Edmonton is home for me. It's where I live, work, and play, and where I became a mom. So I'm privileged to acknowledge my role as a mother. And I've been working in the field of maternal and child health for a very long time, which actually started off feels like many moons ago, in my global health days, where I was working in rural Cambodia and Krong Kep across a number of rural villages where we were addressing some of the similar things that we're doing up in Wood Buffalo with the Aunties Within Reach program, particularly around access to culturally safe reproductive health services, and working in a rural remote area really brought to light a lot of the inequities that people in those geographical areas encounter or experience. So, for the last several years, I've really had the privilege of walking alongside aunties, birth workers, Maddie, as the only Indigenous midwife serving the region of Wood Buffalo, and many community partners. I've been working up in the Wood Buffalo region for 10 years now, and it's been a second home to me in terms of the long relationships and friendships that have been formed. I also wanted to honor and acknowledge that yesterday marked the National Day for the Elimination of Gender-Based Violence. And November is also Family Violence Prevention Month across Canada. So our work centers on creating safer pathways for survivors, strengthening community capacity, and building systems that respond with care, respect, and accountability. One of the things that you will note in our presentation is the symbol of the fireweed. The fireweed flower is a symbol of rebirth, resilience, and healing. So I just wanted to draw your attention to the importance of the fireweed that appears through our presentation, but it's also representative in the Aunties Within Reach program framework, which I'll highlight momentarily. The bright magenta blooms emerge through ash and devastation, symbolizing renewal, resilience, and healing of the land and spirit. So you'll note that when a wildfire happens, the first plant or flower to emerge or grow from that land that's been destroyed is the fireweed plant. So for communities in Wood Buffalo, the symbol carries special meaning. After the 2016 Fort McMurray wildfire, which was known as the Horse River wildfire, as well as many crises that had followed, fireweed became a reminder of what endures, what returns, and what continues to hold us up. So intentionally, we chose the fireweed in the program as a reflection of that strength and resilience and reclaiming knowledge and restoring cultural practices. Wanted to also acknowledge the partnerships that make this work. Many visits, community visits, engagements, and really all of that work is led by our local implementation team in Wood Buffalo, and I'm privileged to have an opportunity to engage and participate as often as I can. And here you can see on the slide some of those opportunities where we're in community, sharing about the Aunties Within Reach program, sharing about Indigenous midwifery. Just last week, I was in Calgary with Maddie and Sheena Bradley, who's a birth worker with the program, attending the Canadian Association of Midwives conference. It was a great opportunity for me to learn more about midwifery in the country, but also just to see Maddie shine on the stage and doing what she does best in sharing her passion and love for the work she does. We also wanted to thank our funders and collaborators who also make this work possible. So we are receiving funding support from the research through the Canadian Institutes for Health Research, the Indigenous Healthy Life Trajectory Initiative. The program team has also received some funding from the government of Alberta to support the hiring of Indigenous patient navigators who, within the context of our Aunties Within Reach program, we refer to as Auntie Navigators. Want to also acknowledge partnership funding from the Women and Children's Health Research Institute at the University of Alberta, and the Health Everywhere Hub, which is funded through the government of Alberta, which has recently allowed us to purchase some equipment to support, including point of care technology, to support outreach midwifery work that Maddie does. And then, of course, all of the in-kind support through a team that I support through the Alberta Spore Support Unit, Learning Health System team, and many of the community partners, as you can see here, and of course, all of the dedication, commitment, love, and energy from my team at the Care Lab. So I'll hand it over to Maddie to introduce the Ikapasqua Collective.
So Ikapasqua Collective is a nonprofit organization. We started in 2021, 3 Indigenous birth workers passionate about Indigenous wellness through a traditional lens gathered together to start our little collective. And we've quickly grown. So we now have a team of 6 people and are continuing to build on our Aunties Within Reach program just based off of the guidance of our grandmothers and the communities that we serve.
Thanks, Maddie. And maybe you want to just highlight a little bit more about the ways in which Ikapasqua is creating safe spaces.
Yeah, so cultural safety isn't a checklist. It's more so about restoring trust, dignity, and belonging for the families that we work with. Many of these families have felt unsafe or unseen within the systems that they are working within. And our job is to rebuild the trust within the system so that they can get the care that they need and deserve. We practice a little bit differently within Ikapasqua Collective. We always prioritize relationships first. We take time to know each person and their story. We provide relational care. So we see them as kin, not cases, and we walk beside them always, not over them. So it really is us walking alongside them over their own journey. And we are just there to support them how they choose to be supported. We also use ceremony and protocol. So smudge, language, songs, land-based medicines, and prayer are always a part of the care that we provide. We have our beautiful space that I wanted to introduce. We have Fireweed Wellness Lodge, which is the home of Ikapasqua Collective and the Aunties Within Reach program. This is a community-led Indigenous midwifery and health hub here in Fort McMurray, where we aim to weave together contemporary medicine with traditional ways of healing. It's a culturally safe space for people to come and access the wraparound care and support that we provide. And here within our practice, we so I see clients in clinic for medical care, but alongside the medical care, we have our auntie navigators. So typically how it works is we have people come and see me in clinic to have their medical care addressed, and then they'll go upstairs and visit with our auntie navigator, Kaylin, and they can there help figure out things like housing, food stability. If there's CFS or Child and Family Services involvement, then Kaylin can really help them navigate that and understand what the process is like, what the steps are that they need to take, and really make sure that they have all of their needs met outside of healthcare, because it's really difficult to focus on healthcare and the pregnancy that they're experiencing when they don't have their basic needs met. So we just like to make sure that they have the time and the space to have all of their questions and concerns dealt with right here under one roof. We're really proud of our beautiful space. So this is just a sneak peek at it, but ultimately we wanted to have it feel like home. We wanted people to come in and see and smell traditional medicines, see beautiful artwork around that makes them feel connected to their culture, and to all the positive things that our culture provides us. And so this is just a little bit about it. We're really proud of it.
Thanks, Maddie. And the team had their open house earlier this fall, which had an amazing turnout from community leaders, community members, partners, friends, colleagues. So the Aunties Within Reach program is a collaboration between the Ikapasqua Collective that Maddie described and the Care Research Lab, which I lead. The Care Lab is situated within the School of Public Health at the University of Alberta. We are an interdisciplinary team of researchers, practitioners, and trainees. Our work is centers the voice, values, perspectives of community health system leaders, healthcare organizations. So we really take a transdisciplinary approach to our work. And what that means is we engage and bring communities or health system leaders, providers together to determine what the right research question and objectives should be and the direction of that research. Our goal is to advance through best practice, evidence and research, equity-centered, person-centered, and community-led approaches. All of our work is really grounded in implementation science, systems science, and complexity science. And those all might feel like big words, but they really help us to understand how systems or healthcare organizations are organized and functioned, which often influences how services are delivered. And understanding those as constraints, they could be barriers or facilitators on how we design, deliver, and implement community-led innovations. And complexity is something that we're constantly navigating. The complexities in the day-to-day work of Maddie, the aunties, birth workers, and how they are navigating systems themselves, navigating complex situations and social and cultural realities of the clients that they support. So complexity offers us a lens to truly understand how that shapes implementation, but also how we design and incorporate strategies to address those complexities. A big part of our work has also been about strengthening the community-based workforce, amplifying the community-based workforce like midwives and birth workers, community navigators, who play essential roles in health system service navigation, outreach, relationship building. And there are a number, from a policy perspective, a number of ongoing strategies in our province and across the country to really amplify and support the community-based workforce. But an important acknowledgement is they're situated within a system that may not have been designed for them. And so our work is acknowledging, again, that complexity and how we can also develop or think through some meaningful strategies to support that workforce. It does involve training and mentorship as well. And as an applied health policy and systems research lab, much of our work is also about studying the policies and systems with the ultimate intention or goal to support policy and system transformation. And we do that through collaborative, participatory, and relationship-based research methods. So we'll now introduce you to the Aunties Within Reach program. So as Maddie mentioned, it's located within the Fireweed Wellness Lodge. It is an award-winning community-led program that we're very proud of. We were the 2024 recipient of Health Quality Alberta's Patient Experience Award. Maddie and Sheena, who really head up the program on the ground themselves, have been recognized for their respective roles in the communities. So really grateful to learn and work alongside them. And as mentioned previously, the research and program design delivery for the Aunties Within Reach program is supported through a 6-year research grant from CIHR's Indigenous Healthy Life Trajectories Initiative, and more to come on that. So the Aunties Within Reach program includes a number of components. It does employ a multi-service model that reflects a wraparound approach to care for Indigenous families. So there's a dedicated support line that families can call for any questions that they have or information about services or programs. The Auntie Navigators support with referrals within and across health and social systems. So Maddie talked about Kaylin, who's our Auntie Resource Navigator, supporting in areas around housing, CFS as examples. Accessing information as well and resources. The local team does a lot of outreach. Maddie was just sharing with me last night that the team was out doing community outreach. And a lot of education too. So organizing workshops on various topics, including infant feeding, breastfeeding, and other areas relating to different stages of reproductive and sexual health. So the team is very busy doing many key things. And so Maddie, was there anything else you wanted to add about the services supports that are offered?
I think you have it pretty well covered. I do just want to highlight, though, that for us, representation matters, that our program is led by a group of Indigenous care providers. We want people to see themselves reflected in the care that we provide. We really feel that this provides a level of safety and trust and confidence for families. And it also uplifts a lot of the Indigenous families within our region, giving them an opportunity to see a career pathway in a more of a traditional community role that a lot of people weren't introduced to as they were choosing their career path. So we are very proud of having our Indigenous team of care providers.
Thanks, Maddie. And it really is a model of community integrated care. So it's Indigenous-led program, but bringing interprofessional knowledge, expertise together. So, and that's really important because they all bring in that strength and wisdom and expertise to really support the whole family. We talked about the Fireweed Wellness Lodge and that the Aunties Within Reach program is now housed in the lodge. And that was an important development in the program, and in part because the team now is all co-located in the same facility. And so we know that community integrated models work more effectively when the team is co-located, and so they can all benefit together from collaborating and engaging in that same space. So Maddie, if I may, one of the things that I thought was really brilliant that you and Kaylin, who's the Auntie Resource Navigator, are doing is, so Maddie will see her clients in that space for 30 minutes, but we'll schedule that client's visit for a full hour. And so Maddie will provide her midwifery care support for the first 30 minutes. And the remaining 30 minutes, they will walk over to see Kaylin, where Kaylin will provide social cultural support, mentorship, and guidance. Coming soon, the Aunties Within Reach program will be expanding. And one of the biggest considerations around expanding reach has been having that continuous presence in the community. So the team was gifted an RV, which will be turned into a mobile perinatal clinic. And we did receive a 3-year grant from CIHR's National Health Research Initiative to develop an implementation strategy for the mobile clinic. And to note, this is an AI-generated concept of the actual mobile, what the vision could look like, but not the actual mobile clinic. So we're a little ways out from that, but it's one of the newest exciting developments. Wanted to give a shout out to Candice Ramjohn, who's a visual alchemist, knowledge mobilization coordinator with the Alberta Sport Support Unit Learning Health System team, who illustrated this for us. And we included this in that grant application to the National Women's Health Research Initiative. This just illustrates our thought process for the implementation mapping that we will do to develop and co-design an implementation strategy for the mobile perinatal clinic. So drawing on implementation science theories and frameworks, and working with community leaders, the Aunties Within Reach team, and others to co-design that implementation strategy. I'll hand that back over to you, Maddie.
Yeah, so we work alongside the grandmothers of the nations that we work in. They really help to guide and shape the work through their teachings, their visions, and their stories. They really help to ensure that their knowledge leads the way and carries forward our work in a respectful way. One of the ways that we have utilized our grandmother's knowledge, stories, and teachings has been through utilizing language throughout our programming. So on the top, you'll see some of the resources that we were able to create, both caring for the caregiver and bringing home baby. These are in Cree and Dene, the languages most common here in Wood Buffalo. And language is really important. So it shapes how we understand health. It shapes how we understand spirit and connection. And for our families, we really want them to be able to see this information within their own language. It brings along comfort, belonging, and meaning to things that otherwise really don't carry a lot of cultural context. And we also have some other programming that has been brought forward because of the knowledge shared through our grandmothers. Things like moontime teachings, where we get to share about becoming a woman and the importance from a cultural perspective about how sacred that time is. And things like safe snagging programs, where we get to teach sexual and reproductive health from a cultural standpoint to our youth. We also utilize harvest or medicines that we harvest. So as a community and as a team, every season we harvest medicines locally. We get to teach about respect and gratitude and safe use of the medicines that the land provides us. So we create teas and tinctures and herbal medicines that really help to uplift our pregnant folks in ways that are culturally safe and medically safe in pregnancy. So Sheena is one of the aunties that we work with, and she's a clinical herbalist. So her knowledge alongside our local elders has really helped shape that. And every medicine carries a story. So we have to honor the spirit of that medicine and the responsibility that it brings. And it teaches us that healing is reciprocal. As we care for the land, it cares for us. So ultimately, this land-based healing really brings balance back into our lives. It helps us return to this place of cultural safety and self-determination and helps us utilize those medicines to strengthen who we are as Indigenous people.
Anything that you wanted to add here, Maddie, around returning to the land? You talked about the importance of medicines.
So, medicines are something that are very sacred to us. And a lot of the time in medicine, we shift more towards Western medicines. And we really believe that there's a place for both. We walk within two worlds always. So, we walk along this Western path where we utilize Western medicine, Western pharmaceuticals, but we also utilize land as that teacher that I'd spoken about. And so we don't see them as alternatives. We see them as ancestral knowledge that continues to sustain our health. And so we see a place for both within our practice. So as we utilize both these things, we really return back to our traditional ways, and we really look at creating space for both things within our current pregnancy care. It isn't something that has to be one or the other. And that two-eyed seeing really helps clients feel like not only they're receiving the best care that they can in their pregnancy, but also that they are feeling supported by the land and from their culture and from the teachings that they've received.
So this brings us, I think, to the main topic of our presentation today on Indigenous midwifery. And really this, for us, it speaks to a shared commitment to reproductive justice. So Maddie, I'll hand it over to you to kind of situate the tone and context here.
Yeah, so reproductive justice, it's more than just having access. It's really a right to what is ultimately theirs, which is access to their land and their culture and ceremony. And birth is ceremony. So we want our children to come into this world feeling well supported and with a sense of community and identity. And through the teachings and history and stories that we have through midwifery, we really have the opportunity to highlight and uplift people's autonomy and that right to safety. And it really is just bringing kids into a world that they belong in and that they feel safe in.
Thanks, Maddie. And I will add that reproductive justice is also about systems, the policies we write, the funding models we design, the governance structures we uphold. And this presentation for us is really an invitation for all of you to reflect, to learn, to act on how we can transform systems so that Indigenous midwifery can flourish across Alberta.
So, reproductive healthcare in Alberta is still something that is quite difficult for Indigenous families, not only because of geographic isolation and access to services, but cultural safety plays a big role within that as well. Here within Alberta specifically, Indigenous people continue to face profound inequities, and this is in all aspects of their life, but within reproductive and sexual healthcare, we see this a lot. We are under a forced birth evacuation policy here in the north. So families have to leave their home community to give birth, sometimes coming alone, leaving their kids and their partners and support people. And not only that, they're leaving this security blanket that their communities and their families provide. So things like access to traditional foods and traditional medicines, and even just like the stories and support of the people that they love. They're having to leave their communities to come to access healthcare, and they're leaving that all behind, and that puts people in a really vulnerable spot. We also have like a lack of culturally grounded maternity services here as the baseline, and the ongoing effects of the colonial practices that we have today really do disrupt these traditional birth practices and traditional midwifery as a whole. We see this as like a disruption of these traditional birth knowledge. Families are coming here and feeling like they have to fit into a system that wasn't made for them. They feel like they have to comply in order to get the best healthcare that they can have, when in reality, it doesn't need to be that way. It's just these systems that we're trying to force people into instead of creating systems that are designed for the people that we serve. And yet, we also know that when Indigenous midwives and birth workers lead care, families can have a different experience. They can really feel that sense of safety. They can feel the trust, not only within the care that they receive, but within their own bodies. I do feel like when people are forced into a Western system, they lose trust in their body's ability to carry babies and to birth babies safer. And so once we reinstill and immerse them within this cultural practice of birth and the ceremony that is birth, we really do instill trust within their bodies and their babies as well. It also provides continuity. So, a lot of the time, because of this birth evacuation policy, families are receiving care from one care provider in their home community. And then when they come into town, they would see somebody different and sometimes multiple different people. Whereas within this Indigenous midwifery framework, we follow them all the way from preconception through the prenatal period, their delivery, and then postpartum for typically 6 to 8 weeks, where at that point we would continue to see them back within our programming. So we really do believe that the families that we serve are kin and not just people who come in for episodic care and then leave. It really does create this shared sense of belonging and dignity and really helps to strengthen their whole family unit. So a long time ago, every community had a midwife. You ask any Indigenous person, um, their grandmothers, they tell stories about how things were before this Western medical system came into effect and the way that they were pushed out. But midwifery used to be thriving within Indigenous communities. We were regulated through community governance, land-based knowledge, and apprenticeship programs where people were taught within a community-based setting. And a lot of us do believe also that there's blood memory is very real. And we learn these things not only through the teachings that we hear orally or the things that we practice with our hands, but our bodies do know. They have this history and this sense of knowledge that comes from more than just things that we can learn through a Western education system. Midwives are highly skilled. They're primary healthcare providers. We support birth, but also we support in reproductive healthcare. We can help coach people through common parenting concerns or just things that are coming up within their lives. We support ceremony and we really uplift community governance. We want people to have that autonomy, not only to birth within ceremony, but to live their lives the way that their communities want to live their lives. And this is the baseline is midwives need to have access to all of these things. We really have shifted into thinking that a Western education system is the only way that people can get the knowledge that they need to serve their communities well. And from an Indigenous midwifery perspective, we know that that's not true. We know that we can train skilled and proficient midwives in community, and they can learn to serve their communities in the way that their communities need to be served. And colonization disrupted midwifery from a very, very basic level. If you look now, Indigenous midwives aren't seen throughout the province and probably across Turtle Island because it became illegal. It became illegal to practice not only midwifery, but traditional practices as a whole. And so a lot of the knowledge that has been held within communities has been put to sleep, and people have hidden that out of fear. And so part of the work that we do is we help to revitalize some of those traditional knowledge systems that are deep within the community. We want people to relearn about the safety of birth and shift that safety perspective away from thinking that it has to be within hospitals or Western systems, and create a sense of safety and trust in birthing within community. And this is not for everybody, but we do fundamentally know and believe that birth can be safe when supported appropriately in community. And we want people to have access to the choice to choose where they're going to have their babies. And that sometimes includes birthing out in rural communities with the support of trained midwives. And a lot of these systems are shaped by funding models and regulations. So, as a registered midwife in Alberta, there are a very rigorous set of policies and procedures and ways that we have to work. And oftentimes these don't align with how communities need and want to receive care. And so these are just some of the current issues that Indigenous midwives face when trying to return to provide the care that their communities need.
Thanks, Maddie. And I'll add that what's important to understand is that today's regulatory and funding barriers in Alberta pertaining to midwifery practice didn't just emerge accidentally. They are the downstream effects of this disruption. So when we talk about policy today, we're talking about whether those colonial systems will continue or whether we will finally make space for Indigenous governance to return. So one of the things that we also wanted to acknowledge is a distinctions-based reality. So Indigenous midwifery is nation-specific, community-governed, as Maddie described, rooted in those distinct teachings and practices, and requires policy and regulation that recognizes this specificity. Ontario has been a really interesting comparator. We've looked at Ontario's model of midwifery. Maddie and Sheena have had an opportunity to visit on several occasions to connect with other midwives, birth workers there. And so Ontario has currently is the only province with a clear active exemption that recognizes Indigenous midwifery as distinct. So Indigenous midwives there are not regulated through the Ontario College of Midwives. They are governed by the communities they serve and can use the protected title, Indigenous Midwife. And this was an amendment to Ontario's Healthcare Professions Act in the early 90s. And so they are supported through dedicated Indigenous midwifery programs. So what Ontario shows us is that Indigenous midwifery can coexist with regulated systems. Community governance does not reduce safety, it strengthens it. And workforce sustainability improves when autonomy is protected.
So in Alberta, we have a different experience here. We don't have access to the same exemption clause under the Regulated Health Professions Act. There is no exemption pathway. The only way currently for midwives to become registered in Alberta is through attending a Western education program, and it is actually quite specific. So in order to practice within Alberta, you do need to go to a Canadian midwifery education program, which is extremely difficult to get into. On average, they take about 12 students a year here in Alberta, and it is very difficult for these students to get into the program, which limits the ability for Indigenous people wanting to access midwifery education to get in and receive the training that they need. We also have a really restrictive funding model. So it's course of care based, which is pregnancy specific. So you are funded only for the pregnancy up until 6 weeks postpartum. And this really downgrades how our care is seen. We do a lot more than pregnancy specific care and believe that we should be compensated for it. And our scope is really restricted. So we aren't able to prescribe a lot of the medications that our families need access to, which further perpetuates all of these colonial barriers that we've put in place, making families are built to disrupt family systems. So, like birth control, as an example, in Alberta, registered midwives can't prescribe birth control. We also can't prescribe medications to help people who are choosing to not continue with their pregnancy. And some people might think that this isn't a big problem because we can refer them on to other colleagues. But in isolated Indigenous communities where people are living and don't have access to the care that they provided is a really big barrier. And there's also that safety aspect where Indigenous midwives people feel safe with, they might not feel safe in a Western system. So ultimately, we can't practice to our full potential. Indigenous midwives are still having problems getting hospital privileges in the communities where they live and want to serve. And we do have a whole bunch of highly skilled primary care providers here in Alberta that aren't utilized to their full scope of practice and are really underutilized, which means that our families aren't being served in the way that we know that they can be served. And this is all coming down to colonial regulations.
Thanks, Maddie. Oh, sorry. I feel like I have butterfingers today. Okay.
So a lot of the time when we look at how Indigenous midwives are seen within the Western system, we're seen as less than, and we're not given the autonomy that we deserve. We're not given respect for the knowledge that we hold, and we face a lot of lateral violence within institutions. We feel like when we are bringing clients into a hospital system that we have to choose who we are going to be loyal to. Are we going to be loyal to our client who we know their needs and we know how to serve them? Or are we going to be loyal to our hospital institution or a regulating body? We really feel like if we stick to the Western system and act as the professionals that they want us to be, that at some point we're going to have to choose to let our clients down. And we shouldn't feel that way. We shouldn't have to fight to have our knowledge respected, and we shouldn't have to choose who we are going to be loyal to. We should be able to provide the care that we need to provide to our clients and know that our regulating body and that the hospital systems that we work in support us as professionals who know how to serve their clients with safety and respect and in a culturally safe way. And ultimately, we're seeing midwives burn out faster than we can keep up with. Recently, we learned that in Alberta, over 90% of midwives have considered leaving the province. And when we look at Indigenous midwives specifically, we are seeing that they are burning out and choosing to leave the profession. And we can't even with the number of midwives that we have now, provide the care that we need to provide. And so as we're losing midwives, they can't be replaced fast enough just based off of our limited education system. And so it is a really big problem that I think that needs to be addressed on a systemic level.
And then, of course, the impact on Indigenous clients and families as well. So when Indigenous midwives are constrained, families also feel those impacts. So care becomes fragmented, trust erodes. Many Indigenous families delay or avoid care altogether. And it's also worth remembering that birth is the number one reason for hospital admissions. So when maternity care systems fail, Indigenous families, when healthcare systems fail Indigenous families, the ripple effects are felt across the entire health and social system. There's also been a growing global movement to bring birth back to community or back to the land. So just in the interest of time, you can see here, we've captured a few snippets from news articles that really speak to sort of the, how midwives are treated within policy and regulatory constraints. The role that advocacy plays in bringing in that desire to bring birth back home. And a lot of, just looking at the one from Hawaii, you can see there's so much contention too in the role of midwives within mainstream healthcare settings. So they're navigating professional dominance. Often their knowledge or expertise is not considered or valued in the same way that Western biomedical knowledge is. So to Maddie's point earlier, that does contribute to the burnout, but then ultimately impacts the patient-centered care that is being provided.
So, Indigenous midwifery is not only a model of care, it's a reclamation of power and a cornerstone of reproductive justice. We do in Alberta have a newly formed group within Alberta Midwives where we have this council where we are aiming to have this level of governance come back into midwifery within the province so that we can advocate for our needs to be met. So currently, the Alberta Association of Midwives advocates on behalf of midwives, but we don't feel like Indigenous midwives' voices are being heard. So we want our voices to be brought to the table so that when it looks at funding or regulatory practices, we want Indigenous midwives' voices to be forefront. And this is something that is new, where we are going to be asked to be seated at the tables with those making decisions so that we can aim to change a lot of these systemic barriers that we're facing.
And there are workforce and geographic considerations to acknowledge as well. So most midwives in the province in Alberta are actually located in urban centers. So to Maddie's point about acknowledging some of the reproductive healthcare access gaps in rural, remote, northern communities. And I mentioned previously that Maddie's the only Indigenous midwife who serves the region of Wood Buffalo. So there are certainly gaps to midwifery care and reproductive health services more generally in northern, rural, remote settings. So it does raise important considerations around workforce development and Indigenous Northern health strategies more generally as well. So without community-based models like Aunties Within Reach, these reproductive inequities in health will continue to grow and widen. So this brings us to the Aunties Within Reach program, why we developed a community-led model of reproductive care. So it was really driven by aspiration. It was the regions. So Maddie and Sheena are trained as Indigenous, full spectrum Indigenous birth workers. And they were the first trained birth workers for the region, and they wanted to bring that knowledge back to the community. There was an identified need and critical gap, which we've been speaking to in terms of limited availability of reproductive maternity services, including traditional and cultural supports. So a desire to want to fill that gap. The community and healthcare context as well. So the region has undergone multiple crises over the years. The 2016 wildfire is one example, but the communities have also been grappling with suicide and the opioid crisis. So there's a lot of social factors that are also contributing to the community's health and well-being. And then also just driven by the desire to redress those colonial legacies and the impacts that historical policy decisions have had on reproductive rights for Indigenous mothers. So go ahead, Maddie. No, over to you.
So, when we talk about walking beside our families, we really want this consistent relational care as a part of the way that we serve them from the moment that they come into care to the moment that they leave care. And through this, I'd spoken to our auntie navigators where they're helping to bridge those systems. Instead of handing clients off through referrals, we really walk alongside them and help them navigate the systems that weren't built for them. So whether it be child and family services, housing, mental health, addictions, or legal supports, we really have our auntie navigator walk alongside them to help them navigate those as best as they can. And then we create these circles of care with our families. So a lot of the time when we see people making care plans, these are things that we are building based off of our own goals from either a medical or a social perspective for these families. Whereas we co-create these with families based off of what is important to them. So whether it be social aspects of their life that they need addressed or medical aspects of their lives that need to be addressed, we help them build these plans and circles of care based off what's important to them so that we are honoring their self-determination, not dictating what they do or directing them on where they need to be or where they need to go. We're ultimately collaborating with them to help them reach those goals. And our collaboration is not only with the client or with other healthcare providers, but we work with organizations across the region that we know offer good support to the families that need their support. Not all organizations are culturally safe, and not all people within organizations are good and safe people for our clients to visit. We also incorporate the care of elders and knowledge holders and grandmothers who can wrap a different level of care around the clients that we serve. And this model builds trust. It builds continuity and empowerment, and the clients know that they're not alone in the system. They're really seen as partners and not recipients of care. And it's important that when we're providing these wraparound supports that we're walking with humility and hope. We know from a strengths-based perspective that people have a lot to bring to the table, and through honoring that and what their goals are and the way that they see forward to reaching those goals, we're ultimately creating safer and more accessible care for them.
So I'm just going to quickly go through the Aunties Within Reach program framework. So as you can see here, I'm bringing back the fireweed motif. And the AWR program is represented by the fireweed plant. So in Indigenous cultures, fireweed represents a symbol of rebirth, resilience, and healing, as I've mentioned previously. And this really is a symbol of what the AWR program stands for and the ways in which they support clients and whole families. So you can see here that in the framework, this petals represent the elements or components of holistic health, so mental health, spiritual, emotional, and physical. The steeples that you can see, represent the traditional, the connection to the land, cultivating connection, traditional roles, establishing health equity, and reproductive health access. The steeples are the structures that protect the flower bud before it blooms and represents the community and cultural factors that support the AWR program. These factors also include traditional medicines and traditional knowledge. Like the stem of the fireweed plant, the stem of the AWR framework is the foundation and represents the values in which the AWR program is rooted. So I don't know why that keeps happening. So examples include a sense of belonging, the importance of the knowledge and teachings from elders, community, voice, and values. And the external factors that you see outside the framework here, so environmental factors, social determinants, economic disruption, these are what we often refer to as the pollution or the pollutants that act as the barriers to the fireweed growing strong and resilient. So we've been using the fireweed metaphor and the AWR framework to guide all of our work, our research in the Aunties Within Reach program. In terms of how the program is implemented and evaluated, the framework represents, it has been very strong in guiding those aspects in terms of the implementation and evaluation questions we asked. It helps us to really better understand the importance of relational strategies that are involved in implementation, both our implementation journey and process, and the importance of trust, empathy, and supporting community relationships and clients, and the co-learning that takes place between my research team and the Aunties Within Reach program. So we've been doing some active work within our research team to move that program framework into a program theory. So the AWR framework operates in a complex environment, and like all things that are implemented in complex environments, require constant adaptation. So we see the program as a model of learning, how we gather information, how we honor our relationships in that process is all part of our learning, and how we can learn within the complexities of the health and social systems, but even in the complexities in terms of the social and cultural realities of clients being served. Metaphors are powerful tools for communication. Metaphors are also cognitive and relational bridges. They enable us to integrate across different knowledge systems or ways of knowing, and allows us to do some of that important work around sense making and how we make sense of what's happening in terms of the surroundings of the program and how the program is being delivered and operated. So I'm going to just in the interest of time. So a lot of, again, that work has really been brought into our own reflection through collaborative and iterative activities that our team has taken on with the Aunties Within Reach program team. Here's an example of how we've integrated implementation science theories, one in particular here being the CFIR framework, which is the Consolidated Framework for Implementation Research, and utilize the constructs of that implementation determinants framework alongside the Aunties Within Reach program framework to make those connections, to better understand implementation process, context, and again, as mentioned earlier, also used to evaluate the implementation of the AWR program. Other aspects of the Indigenous Healthy Life Trajectory Initiative include a cross-sectional survey that we will be administering to Indigenous families to understand health, wellness, cultural strengths, and intergenerational experiences across the life course. And we'll also be establishing a pregnancy cohort of pregnant moms, birthing individuals, their families who are also participating in the Aunties Within Reach program or receiving care and support from the Aunties Within Reach program. And we'll be following those families who are receiving support from the program to understand impacts on their wellness, connection, and perinatal experiences. Just wanted to acknowledge that all the work we do is relational, and relationality is so important to do this work in a good way. So we're tending to the soil by honoring our partnerships with the Ikapasqua Collective and the Aunties Within Reach team. We're blooming together as we are co-creating, co-learning. And we are also seeing knowledge with care. So as the fireweed disperses, it's also about understanding why we're doing this and what our purpose is. So thinking about the future generations to come, and as Maddie mentioned before, revitalizing those traditional knowledges that have been kept silent. And thinking about sustainment. We know to do this work, it demands courageous leadership. We need to continuously acknowledge, understand, study the dynamics around the implementation and delivery of the program. We always take hold of opportunities as they present themselves. We are continuing to fill our cup, grow our networks, expand our relationships. Any opportunity where there is space for Maddie, Sheena, other members of the team to share their stories and perspectives are all important opportunities to take hold of. We embrace complexity, I might add, rather than just embracing it or acknowledging that it exists. And all of the work we do, we dance with it. So it's not always, we don't always need to see it as a barrier or a challenge, but how we think through the complexities in the day-to-day of the program or other can be really fruitful in just understanding our role and how we can expand and do the work we do. And of course, being relational in all aspects of our work. And this is a call for Indigenous midwives in the province to keep taking up space And with that, I just want to say thank you. I want to thank the Partnership for Women's Health Research again for honoring me with the Mid-Career Excellence in Women's Health Research Award. Want to acknowledge the Women and Children's Health Research Institute as well for also supporting me throughout my academic journey. And of course, last but definitely not least, Maddie, truly grateful for you to share this space with me today. And thank you for you and your team's trust in us and walking this journey with you. So thank you so much for listening.
Thank you so much, Stephanie and Maddie, for this very inspirational talk of how Indigenous midwifery is transforming care in the Wood Buffalo community, and also giving us such great insights into what are the policy and structural levers that need to be changed in order to scale and spread across Alberta, but also across the country and beyond. I know that we are at time, but I do want to just give a chance if there are burning questions in the audience. Put up your hand now, and I think we could take a minute or two to answer those. So I'm just opening a little space for that. If there aren't, you know that you can always reach out to me and also to Stephanie and to Maddie to learn more about this work and how it's moving forward and perhaps how to be involved as well. So I'm not seeing hands up. So I will just express my gratitude for the work that you're doing to transform the lives of women, families, and communities, and this fantastic research. And thanks to everyone who attended today. Right.
Thank you, everyone.
Thanks, everyone.